In this video, we're going to talk you through a rehabilitation program for an ankle sprain. So if you have rolled your ankle recently or have done it in the past and it's still giving you problems, this video will be perfect for you. We're going to break it down into two parts in effect. So the first part is just the mobilisation of the ankle, which can be done quite soon after the sprain or the strain or the trauma to the ankle. And then we're going to work more into the stabilisation, proprioception and strength of the ankle, which is more towards the latter end of the rehab program. So we don't want to be doing that straight away. This is also quite good as a rehabilitation. So if you've sprained your ankle a while ago and are still getting problems, or if you never rehabbed it properly in the first place, this video will also be really good for that. It's a really good strength builder for your ankles. So if you play a sport that is quite prone to ankle sprains, so something like netball or basketball or off-road running, this will be a really good video to go through, especially the end of the video, to help stop you from spraining your ankle in the first place, to strengthen it, increase that stabilisation and that proprioception. When we do talk ankle sprains, we tend to find that the ankle movement of rolling out is when people are spraining. So if you're rolling out with your ankle, that's tend to when they go. If we roll in, we have our hips and our knees can stop that movement, or the other leg can stop that movement. So very rarely are we doing any damage to the medial ligaments. It tends to be the ones on the outside. The calcaneofibular ligament, which runs down here, and the anterior talofibula, which is the one that runs across the front. That one I tend to find is the one that people sprain the most, but it can be a combination of any of the ones on the lateral side. All we want to do to start with, so this is the first phase of the video, this can be done quite soon after the initial trauma, is try to mobilise that ankle. The body's natural response to pain is to stop movement of that joint, so everything around it tenses up. Initially that's great if we want to just get back and stop doing any more damage. Once we're on the rehab process and we know what's gone on and what the trauma has been, we can then start to mobilise that ankle. So I'm using my left ankle as the example, and I'm just going to go into plantar flexion, so pointing my toes, and dorsiflexion, bringing my toes back up towards my face. And I'm just going to roll through those two movements. Doing this passively, so as far as I feel like I can go with my ankle without any assistance. If I do both ankles at the same time, you'll find the one you've sprained, there's a lot less movement in it. Initially, that's okay. We will promote more movement as we work through this video. So just running through dorsiflexion and plantar flexion. The next mobilisation movement is going to be inversion, so pointing my soles towards each other, and eversion. So I just want to try and point my soles away. Eversion is a lot more difficult and you won't get as much movement. Notice when I'm doing those, I'm going into slight plantar flexion when I invert, and that is really stressing those two ligaments that we talked about. So you might get a little bit of pain if it's those ligaments you've done. A little bit of pain is good, rehab needs that. So it's just reminding the body it's a bit sore, but it's also stressing that ligament, which is how they get better. So again, a little bit of plantar flexion as I invert, and a little bit of dorsiflexion as I evert. And we're just going to roll through those. So dorsiflex, plantarflex, invert, and evert. And just keep moving those. And you can do this throughout the day. So if you're sat at your desk at work, or you're sat on the sofa at home, just keep taking your ankles through those movements. From there, we're again going to try and write the alphabet with our ankle. All we're doing here is just the alphabet will just keep us occupied, and we're just getting lots of movement into that ankle. By going through all the way through the alphabet, we're starting to get a little bit of fatigue in there as well. So just lots of rolling around, up and down, dorsiflex, plantarflex, invert, evert, as we go through that alphabet. We'll start to feel it get a little bit sore, we'll start to feel the ligaments complain. Again, that's a good thing. The body likes stress, it likes to be loaded. It's how it gets stronger, it's how it adapts to the movement and gets better. So just write the alphabet there. We can do that with our leg up if we want, or we can do that with our leg down. Leg down is a lot easier, so maybe start there and then progress. From there, we're then going to go up onto our feet, and we're just going to start to mobilise our foot now. So if I swap to my right foot or my right ankle, and we're just going to go for a toe crunch and then a toe extend. So if you have a towel, you can put a towel on the floor and just try and bring that towel back towards you, and then just try and push it away as you extend your toes out. By mobilising the foot, all of the muscles that do that run through the ankle and they originate from around here. So again, everything that passes across that joint, we're just trying to move. So you can probably see on the camera there, a little bit of movement here on the skin just as those muscles and tendons are working. So just getting the foot and the ankle to release and start to encourage movement. If we then go back onto the floor, and this is where the towel or the band comes in if you're using a towel at home, and we just want to start to go through active range of motion or active range of movement around the joint. So to start with, we're going to focus on dorsiflexion. So I've wrapped around the ball of my foot. I want that to be off my toes, so I want the ankle to move, not my toes. And I'm just going to go into as much dorsiflexion as I can, and then with the band or the towel, I'm just going to pull that back a little bit more. The ankle is a very strong joint, so things like the Achilles tendon, very, very strong. So there's not going to be loads of extra movement in there, but just enough to promote increased mobility around the ankle joint. Again, on the dorsiflexion, we might feel a little bit of soreness from where the ligaments have been sprained, just as we're shortening them. But again, a little bit of pain is okay as long as we're comfortable with it. As long as it's not a really sharp stabbing pain, we're in control. From there, you can also then attach the band in front of you to plantar flex, or you can go up into the half kneeling position, and then you can rock your foot forward to get dorsiflexion, and then rock back. Keep your foot down, so either put a weight on there, or in this case, I could just put my hand there to keep it down, and again, just plantar flex and get a little bit more movement into there. Again, we might feel a little bit of stress or pain across the top of the foot. As long as we're comfortable with that, that's a good thing. And we can just continue to roll through those until we feel our ankle is starting to loosen off. I would always focus on doing that, even if you just want to do the strength stuff. Mobilize the ankle first. You can do that throughout the day. This is where we come to the second phase, or the next stage of this video, where we start to work on the proprioception, the stability and the strength of the ankle. A lot of people report back, once they've sprained an ankle, it feels really wobbly and they don't feel secure on it. That's because we've lost proprioception and stability there, so the brain doesn't really know how to keep the ankle strong, how to react to certain movements. So every time we slightly roll out, we just feel like the ankle is going to collapse on us. So this is how we correct that and stop that from happening. To do that, we're going to come up onto our feet. I have a video on proprioception as well, so I'll put a link to that at the end of this video. Really, really good thing to work on. Helps with things like hand-eye coordination, and it helps, especially adolescent athletes, it helps stop injuries like rolling your ankle. So all we're going to do is we are going to stand on one leg. Sounds really, really simple, but if we do this with an ankle sprain or a recent ankle sprain, it's actually quite difficult. To start with, we want to just focus on one point. So all we're getting the brain to do is focus on keeping that ankle nice and still and strong. And even just doing that, haven't sprained my ankles, so my ankles are nice and strong. Even just doing that, I can feel my ankle working nicely. I'm a little bit off balance every so often. My brain is just working to correct that every time I do go off balance. You probably see everything around my ankle and the top of the foot working. And again, that's just the brain focusing on contracting the right muscles to keep me nice and balanced. The longer I stay here, the more my ankle is starting to fatigue. Next thing I'm going to do is I'm going to add in a tennis ball. All this is doing is distracting my brain and my focus. So again, we're talking proprioception, understanding what my body is doing, get the brain to work with that ankle. So all I'm going to do again, stand on one leg. This time I'm going to distract my vision and my brain by throwing tennis ball up and catching it between each hand. So now my focus isn't on the floor, it's not on my ankle, it's on catching that ball. And straight away you can see I'm a little bit more unsteady, ankle's moving a little bit more, and I can feel that's harder on my ankle, so I'm working a little bit harder. If you have someone else with you, you can get someone to throw the ball at you, because then that means you have to respond to their throw, or you can throw it at the wall. So I might have to come over here to catch it, I might have to come over there, and just again, I'm responding with my body, but the proprioception, or the increased receptors within my brain, are telling my ankle what to do, and I'm staying nice and stable. Really important proprioception for knees and for ankles, specifically if you have sprained your ankle recently. Work through that, continue to throw up a ball. Again, stick with that one until you feel really solid. So if you're doing that, if you're stood on one leg and you keep having to go off balance and correct, stick with that one until you're really solid and you just feel like you're not going to go anywhere. Once you're happy with that movement, this is where we bring in the wobble cushion. And we're going to do exactly the same thing, but obviously now we're on an unstable surface. So if we talk basketball, we're not quite sure how and where we're going to land. We might be landing on someone else's foot. If we're off road running, trail running, we might land on a bit of a rock and roll ourselves out. We want our body to respond quickly. So again, proprioception. We want our ankles to be nice and strong. And we want to respond quickly to that. So effectively, by standing on the wobble cushion, we're replicating that movement. We're not quite sure what we're going to be landing on. So straight away, just by doing that, you can see my ankle is moving a lot more. Again, at the moment, I'm just fixed on one point on the floor. I know you can't see my face, but my eyes are very focused on one point. So all of my focus is going on to keeping that ankle nice and stable. Once I feel like I'm really, really strong there, again, add in the tennis ball. So onto one leg, up. Get really solid, so fix your focus on something, really, really solid with my ankle. And then from there, I can just start to throw the tennis ball between my left and my right hand. So now my focus and my balance has gone a little bit, so you can see a lot more wobbly, but at no point do I feel like I'm going to fall off of that wobble cushion. So yeah, I might be needing to correct, but I'm not going to fall off the cushion. Again, if you have someone with you, get them to throw the ball at you so your body is having to respond. The more you can do this, the better. You should get to a point now where you feel like you're not going to move off that wobble cushion. So you shouldn't be feeling like, oh, I've fallen over here or I've fallen over there and needing to put your right foot down to respond. So you should be able to stay on there, and you should be able to stay on there for a long period of time as well. So you'll start to fatigue your ankle, but you'll feel like you're in control the whole time. Those are all of the movements we're going to do. It is very much about a continual progression when we talk stability and proprioception of our ankles. We will guide you through it, so do keep commenting and feeding back how you're feeling throughout, especially if you're coming in for treatments as well. We can catch up each time. Try those exercises, start by mobilising, and then start by increasing the proprioception and the stability through that ankle joint. I hope those videos really, really help, and we will guide you through the rehabilitation program. Thank you for watching, and we'll see you soon.